Hello everyone. As a practicing doctor for almost 30 years and a surgeon as well, I'm going to share something super important. So please listen till the end because this can really save lives. And this is my humble request. Please share it with as many people as you can because for the first time in the world, I'm going to say something which will immediately open up all knowledge which is inside of you. How are we handling this COVID? With all the lockdown, everything which is happening, people have been told to be in self-quarantine or home quarantine for 2 weeks. They need a stamp, they need to be told to stay home. This is ridiculous. How can we cure the COVID now? It's very simple. We are going to treat it exactly as we would treat chickenpox. In chickenpox, we would see the lesions outside. So what do? You self-isolate, you stay in a room in the house, and all you do is you sleep and sleep and sleep, hydrate yourself. And this is the only way to cure the COVID. What are you going to do when you're diagnosed? Number one, don't panic. Go home, make yourself comfortable in one room, drink a lot of water, and the most important thing is to sleep and to sleep and to sleep more. You have only options of what position you sleep in, but this is the most important thing because more than any medicine, this is what can push your immunity up. So COVID mother or COVID amma, as it is called in the entire south of India, as well as they associate chickenpox again with Shitla Devi, who's a goddess. So if people understand, if we tell them that this is actually COVID mother, which is similar to chickenpox, that means don't go anywhere, don't run from Chennai to Coimbatore because you're diagnosed with COVID thinking you're going to get better. Don't hide the fact that you've been diagnosed from your doctor and run in for a surgery because you're putting your own life at risk as well as the doctor's life at risk. So what do you do when you're home? Keep your metabolism very low because you don't want the cytokine storm to happen. How do you keep your metabolism low? People are saying, do this breathing exercise, do this yoga, do this exercise. Once you're diagnosed, I promise you it is dangerous for you to actually be doing any of these exercises, be it breathing, be it yoga, be it other exercise, because all this will push your metabolism up and it can actually send you in the hospital. So again, rest and only rest. No exercise, whether it's standing upside down or downside up, it's not required because all you need to do is allow your body to heal. So what is this cytokine storm? You have a whole army inside of you, which is your innate immune system. And this has a front line, they are the frontliners. Immediately the message, the moment the virus enters and gets attached to the S, that is a spike protein gets attached, immediately you have a warning that there is an intruder. So the entire burglar alarm goes off. But then you need the burglar alarm to shut down. You don't want it to keep on going up. So we will discuss about this in the later episodes where I will be speaking specifically how you manage the cytokine storm. But for now, if we can spread the message that we are going to treat COVID exactly the way we would treat chickenpox. Where has all our knowledge of infectious diseases gone? Why have we forgotten from the earlier pandemics of, we had the earlier flu pandemic as well as the SARS virus, which is again related to the COVID, where we always had the cytokine storm. So let's remember, if you had chickenpox, what would you do? You would be home. Would you travel running to another city? No, you would not do that. So the moment you're diagnosed, make sure you're at home for at least 2 weeks. You don't have to be told by anyone because exactly as in chickenpox, keep the other family members away, have your own plate, have your own glass, which you're drinking from. Eat simple carbohydrates because they give you energy quickly, easy to digest, and they don't put a strain on your metabolism. They don't push you towards a cytokine storm. So what would this be? Something say like a porridge or idlis for breakfast. You can have something like khichdi or curd rice or rasam and rice. All these things contain also the ginger and the turmeric. Whatever is good for you is simple and easy to digest. And the same thing again at night, or a soup, whatever you fancy, but nothing too full of fat, nothing too full of proteins, exactly like a viral hepatitis, exactly like a chicken pox. Simple, easy to digest food. And then what are the herbs which you would take? Again, vitamin A, B, C, and D. Make sure you don't get intoxicated with it, but you know, vitamin C again is really important in altering the cytokine storm, and N-acetylcysteine, again, this is fantastic. It plays a great role in modulating what happens with your immune system. And then we have a great herb called ashwagandha and tulsi combined with ginger and turmeric. These are the things if you have COVID. And then the turmeric itself has been clinically proven. This is published in the Journal of Cancer. Actually, what it does is it prevents the cytokine storm. So here I'm using the wild Assam turmeric, just 1 drop or even a teaspoon with some pepper in your food, in your khichdi, and that should take care of it. To reduce the viral load, this beloved friend from Australia has given me this tea tree oil. So just inhaling this, because the virus sits in the coolest part, which is the junction of your nose and throat, in your nasopharynx. So you would use the nasal drops first, and then you would inhale steam with some salt, turmeric, and 2 drops of tea tree oil. This is proven to reduce the viral load, because how do you shift from the first phase to the second phase of the cytokine storm? Is only when the viral load is more, and then everything goes haywire. So it's super simple. And if you're having breathing difficulty, you must have a pulse oximeter where you check what is going on with your oxygenation levels, and only then you need to call a doctor or approach a hospital. I've heard the most ridiculous jokes yesterday. Apparently in Bangalore, healthy people living in a gated community, a woman got a notice from her association saying that what you need to do is pay 10,000 rupees as an advance to book a bed in a hospital. This is a woman who's completely healthy, who has no COVID. So you get priority of a hospital bed whenever you need it. And then in case you die, you have to let them know where your car key is so they can repark your car, and also where the other keys to your things are there in your home or apartment. It's so absurd because the fear is more harmful. You're secreting so much of cortisol and epinephrine, everything which is against your healing. So really, really stay completely peaceful and calm. Even if you have been diagnosed positive, we have seen 1,000 viruses. Our immune system is so ancient and strong. Please spread the message that this is COVID mother or COVID amma. And people will understand why they must not, if they're diagnosed, even if they're asymptomatic, why they must remain home. You don't need the government, you don't need the police to tell you this. All you need is common sense. Tomorrow, again, I will be going into the details of the treatment, but the message here is treat it as a chicken pox, act as you would do if you had a chicken pox, and only rest and rest and rest. And lying on your belly, like how dogs or cats lie down, is also beneficial, because then it helps in opening up all the unused parts of the lungs. And once again, stay home, be healthy, don't be afraid at all. We can conquer this and anything which comes. We are all strong as long as we don't lose it in fear and run. If we can stay away from a hospital, go if you need medical attention, go if you have a complication, but try to sort it out naturally at home. So thank you so much, and please, please, please share it. This is from my heart, because we need to stop the spread of the virus. We need to break the chain. There's no use telling people. We have to actually give them the knowledge why to break the chain. Thank you so much.